The Limpopo MEC for Health, Dieketseng Mashego, has welcomed the arrival of 106 newborn babies who were delivered at public health facilities across the province between Wednesday midnight and noon Thursday. Of the total births, 51 are boys and 55 are girls, reflecting a positive and hopeful start to the new year for many families in Limpopo. The MEC extended her heartfelt congratulations to all new mothers and families, commending healthcare officials for their continued dedication in ensuring safe deliveries and quality maternal and neonatal care during this busy period. During her visit to Voortrekker Hospital and Jane Furse health facilities, MEC Mashego personally welcomed the New Year babies, congratulated the mothers and presented them with gifts as a token of appreciation and support. One of the key issues concerning the department, though, is the high rate of teenage pregnancies. We have asked Limpopo Health MEC to join us, and she's with us now. MEC Mashego, good evening. Thank you so much for your time. Welcome to the show. Teenage pregnancy is a relentless problem that plagues the country nationwide, but it plagues provinces with large rural communities in particularly more, and Limpopo is one such problem. Can you describe to us the extent of the teenage pregnancy problem in the province, but also, very specifically, its then overlap with things and cases such as statutory rape where applicable?
Thank you very much for having me, and good evening to you and the viewers. Indeed, we have welcomed the babies and we're congratulating them during New Year's, and actually the number had gone up to 234 by the end of New Year's Day. And indeed, the issue of teenage mothers, we are still experiencing it because on New Year's Day only we had have 25 children who were born from teenage mothers. But what is concerning is amongst those 25, we had those who are underage. We have a 16-year-old who gave birth. We also have a 14-year-old that gave birth, which is what we really are concerned about, to say, indeed, the issue of statutory rape is still happening within our communities. And we are saying, as the department, we'll continue to strengthen our health educations that we have in our schools, in our communities, but we are also making a call to all community leaders, our organizations, and even our community members to form part so that we can all work together to do away with the child abuse that is happening within our communities. Because the reason we are raising this is that when we communicate with these underage mothers, these are underage mothers who believe that they are in a relationship with the adults. So we are saying relationships happen within communities. We should not only be able to know about it when they present themselves in our clinics, when they are already pregnant, or in our hospitals, but we are saying within the communities, when we see an older person saying they are in a relationship with a child, we should report it as child abuse, so that we can have our police assisting us to end this thing of statutory rape happening within our community.
MEC, part of the problem with grooming of teenagers and adolescent girls is that it often happens clandestinely, and these young girls are coerced and often threatened into silence. That is to say, oftentimes communities are none the wiser for the most part, and also only become aware once there's a visible pregnancy. So I want to then ask, what efforts is the Department of Health and health officials taking when a teenage or adolescent girl presents pregnant at a clinic or a hospital? And is there any efforts to establish whether or not this was as a result of statutory rape? And are there any efforts to ensure that consequences follow? That is to say, that the police investigate and carry out arrests. I know it's not your responsibility, you're not law enforcement, but surely as the person who receives this information at the point of first instance, something must be done with it.
Yes, and something is being done, because now when you present yourself as a teenage mother who you are underage in any of our facilities, we've got a form that we call Form 22, which we feel all our health professionals, they know. We have to fill up that form. It's where we are actually reporting the abuse. We report it to social services. We also report it to the police, so that they can be able to investigate. And in terms of social services, that's where they dispatch the social workers to go visit the family, so that they can be able to understand what is happening within the family and within the community, that might have led to the child falling pregnant.
Yeah. Are there any specific patterns that you're picking up in terms of the numbers about which girls, geographically or otherwise, are most susceptible and vulnerable to teenage and adolescent pregnancies?
No, what we are seeing now is that when we talk about the girls between the ages 13 to 15, it's where we find they are vulnerable. And if you can check the ages, it's where most of them are going through the period of adolescent. That's where we are saying now the importance of having a communication or a good relationship with your child as a parent is very much important, because some of these kids during that age, the advice that they get, or the only advice that they get, will be through their friends, their schoolmates, who are also around the same age as them. And we believe that those kind of advices might not actually be leading them to a positive thing. So that is why we are saying, as much as we are working as a government, but also we need our parents to be on board, to be able to have a relationship with their kids, so that they can be able to parent their kids, they can be able to have that open communication with them, that when a child starts saying now they are dating, they should be able to talk to their mother, and their mother should be able, or any other guidance that they have, so that they can be able to advise them and also to take necessary steps where they see that their child is being abused.
Yeah. Importantly, MEC, is the question around the pattern of the men who typically father and impregnate these young girls, and in fact, by law, are raping them. If the pattern, what does the numbers tell you? Have you taken a deeper look at the numbers to establish whether or not these men typically are within the family, are family friends, or are strangers in the communities? How do they typically target these girls? How do they begin to groom them? And oftentimes, how old are they themselves, the men that are responsible for this?
No, what we have learned here in Limpopo is that those are members of the community. Mostly it would be men who are working. It means they are able to entice our young girls with money and gifts so that they can be in a relationship with them. So we are saying it happens mostly where our children are from poor backgrounds, and the man who's older, because a man can be as old as around 30, while they are saying they are in a relationship with a 15-year-old. So it tells you that it is because of what they can be able to give to a child. So we are saying, indeed, if we really do strengthen the issue of saying we report these kinds of crimes as and when they happen within our communities, we can be able to stop these men.
Yeah, MEC, thank you so much for your time. Really do appreciate it. That is MEC of Health in Limpopo, MEC Mashego.